that a stuffy nose might be making it impossible for you to get a good night's sleep.
And if you have a sleep apnea, a stuffy nose could prevent your treatment from actually working too. So Dr. Madan Kandula is here with Advanced Ear, Nose, and Throat Specialist with more on that topic. Welcome to the show.
Morning.
Thank you. Good morning.
Happy Father's Day.
Thank you. Thank you very much.
Yeah.
Good to see you again. Well, I think a lot of people suffer from that chronic stuffy nose symptom. You know, we actually had someone I remember from high school who had it. And I think it makes a lot of sense that when they lay down at night, you kind of get more of that congestion.
Right.
So what can people be doing about that?
Yeah, I mean, the phenomena that's there when somebody experiences that is pretty much anybody who's kind of getting by during the day. If they lay down, or when they lay down to go to sleep at night, their troubles tend to be exponentially worse. What tends to happen is just the tissue in the nose just engorges. So gravity is your friend during the day. It's kind of your enemy at night. And so, you know, the blood kind of pulls in your nose. And so if you had maybe a little bit of a millimeter to breathe through, that's gone. And so most folks I see who have chronically stuffy noses, either they'll bring it up or I'll bring it up to them. You know, is it worse at night? And pretty much a guarantee it's going to be. And
is it more anatomy or that gravity thing that you mentioned?
Both. I mean, usually it tends to be they've got anatomic issues that are narrowing them down. And again, they can get by, they can kind of sneak by. And then the gravity issue just kind of puts them over the edge, and then they're really kind of stuck in that
point. And are
a
lot of people affected by what you would consider to be a true chronic stuffy nose?
Yeah, absolutely. Lots. Millions and millions of people. And you know, a lot of those folks, and we've talked about this before, they don't know much different. A lot of them have been conditioned throughout their life that this is the way life is supposed to be, this is your destiny, and they don't know. And so, you know, your destiny is to have a stuffed up nose. And so the impact during the day tends to be fairly obvious. As far as your sleep goes, it's not so obvious. And usually the times where I tend to see it the most obvious is after we've made a big change for somebody, you know, fix their stuffy nose, and all of a sudden, bam, you know, they're breathing through the nose, they're sleeping better, they're just feeling a whole lot differently about, you know, day-to-day life.
But if they're not sleeping better, that can really be an issue, because let's talk about how important sleep is to us, and also if you're not sleeping with a chronic stuffy nose, what stages of your sleep are really being interrupted?
Well, basically, if somebody is not able to breathe through the nose, so your body is designed to breathe through your nose during the day and during the night, and if it can't do that, then that disrupts your quality of sleep. And there are various layers of sleep or levels of sleep, and for folks who have a chronically stuffed up nose, they never get to the deepest levels of sleep. They've done lots of studies looking at that, where they take somebody who's healthy, who can breathe through the nose, do a study and see how they sleep, and then they plug their nose up the next night and see what happens. And everybody, 100% of the time, it's going to negatively impact your quality of sleep.
Is medication often the answer?
It can be, you know, so if somebody's issues are allergy related, I mean, that's usually it. I mean, most of the medicines are out there that help to treat chronic stuffiness go after allergy issues. So if your issues are allergies mainly, then those can help. A lot of folks, it's a mixed bag. It's either some anatomic issues and allergy issues, or purely just anatomy.
And is it a mixed bag too between snoring with something that's a chronic stuffy nose, or somebody who just has another problem?
Yeah, pretty much anybody who's got the potential to snore, if you stuff their noses up, they're going to snore majorly. It's going to crank the volume up. So they got to have that potential there. Most people have that potential, and you know, a lot of folks get by being able to breathe through the nose. But again, the nose tends to kind of swing that dynamic one way or another, usually negatively.
One of the things that can really affect sleep is sleep apnea, which is a medical condition that can be diagnosed. I know a lot of times we hear about it through sleep studies and things like that. But CPAP, the breathing machine where it kind of forces air into the nasal cavity, is kind of considered the gold standard in terms of treatment if someone's been diagnosed and they're receiving treatment for it. I would think if you have a chronic stuffy nose, that's going to be a problem with what we consider to be the gold standard for treating sleep apnea.
Yeah, absolutely. I mean, it's one of those, it's oftentimes overlooked, but it's a major barrier for, there's many folks who know they have sleep apnea, know they need to do something about it, try a CPAP machine and just not doing the trick. And lots of those folks, I'd say majority of those folks, the issue is mainly coming back to their nose. So with the CPAP machine, it fits either on your nose or your mouth. If your nose is stuffed up and you try to shove something over their entire face, which is the other alternative, it's pretty panicky. I mean, if you think about it, you got 3 breathing holes and 2 of them are plugged, and you're going to plug the other one up. It's not going to be a fun situation.
Kind of like claustrophobia.
Yeah, I mean, it's like you're suffocating. You know, somebody who's has an issue and then they're dealing with the suffocation and they want to get help, they want to do something right, but then their nose is their barrier. And a lot of times, like I said, it's just not really sort of pinned down. What's the issue? Why am I having this trouble? And oftentimes when somebody comes in who has sleep apnea and we take a peek, nose is blocked up, and a lot of times it's just that, getting the nose working, getting the machine working for them, and that can be a huge impact. I mean, that you're taking two major steps in a forward direction. It's a night and day difference a lot of times.
Yeah.
What do you recommend for somebody who has trouble sleeping but doesn't have the sleep apnea?
If they've got the nasal congestion issues, getting in and getting it checked out is absolutely the only way to do it. Because there's really no way to know whether you've got an anatomic issue, allergy issue, sinus issue, unless somebody's taking a peek in there, taking a look around and seeing what's going on. If it's, if it is about the allergies, the medicines work. If it's about the anatomy, then doing something about that can make a big time difference. If you've got sleep issues just in general, and a lot of times it's just not really clear what's the deal. And so sometimes the deal is the nose. And again, if it's that, then the good thing is we can do, there's lots of different options coming after that.
And there are a lot of options where there's very little or no downtime, which I think is key for this. And everybody wants a good night's sleep.
Yep.
So I think it's important that people at least have it checked out. If you have a chronic stuffy nose and not sure what it's related to, you can get a hold of the people at Advent by calling the phone number on your screen. It's 414-771-6780. They're located on North Mayfair Road, and the website for more information is advent.md. Always a pleasure to have you on the show.
Thank you.
Thanks,
Thank you
Doctor.
very much.